As we get older, taking care of our hearts becomes critical. But what if I told you the biggest danger isn't your diet or stress? What if it's sitting in your medicine cabinet right now? I'm Dr. Marcus Chen, a senior cardiologist, and today I need to talk to you about something that keeps me up at night. Doctors across the country are sounding the alarm, not about rare diseases, not about surgeries, but about everyday pills that millions of seniors take without knowing the risks. These are FDA-approved medications, prescribed by doctors, available everywhere. But in aging bodies, they can quietly increase your risk of heart failure, stroke, or sudden cardiac events. Here's what worries me most. Most seniors never get warned. Prescriptions get refilled automatically. Side effects? They're blamed on just getting older. Dangerous combinations? Often missed completely. But that ends today. I'm going to share 5 medications that can damage aging hearts, especially after 60. Some you'll recognize immediately. Others will surprise you. But every single one deserves a closer look. This isn't about fear. It's about facts. Research-backed, expert-trusted, explained simply. If you're over 60 or if you care about someone who is, pay attention. What you learn today could protect your heart, your independence, and maybe even your life. Before we dive in, take a second to hit the like button. It really helps this video reach more seniors who need this information, and that's how we help more people together. And I'd love to know, where are you watching from? Drop your city or country in the comments. It's always inspiring to see seniors from around the world coming together to take charge of their health. Now, let's start with number 5. It's in almost every home, and it might be quietly hurting your heart. Number 5. Pain pills, NSAIDs, the hidden heart strain. Ibuprofen, naproxen, Aleve, Advil. You know these names. They're in your bathroom, your kitchen drawer, maybe your purse. When arthritis flares up, when your back hurts, when you get a headache, you take one. Simple. But after 60, these common pills become risky, really risky. These are called NSAIDs, non-steroidal anti-inflammatory drugs. Yes, they stop pain, but they also mess with how your kidneys handle salt and water. And here's the problem. After 60, your kidneys don't work as well as they used to, even if your doctor says your lab results look fine. So what happens? Your body starts holding on to water. You notice swollen ankles. Your shoes feel tighter. Your legs feel heavier. You're more tired by evening. Most people think, I'm just getting older, but often it's the pills. This extra fluid makes your heart work harder, much harder. If you already have high blood pressure or heart disease, this added pressure can trigger heart failure. It can cause dangerous blood pressure spikes. And it gets worse. NSAIDs cut blood flow to your kidneys, damaging them over time. Studies link them to high blood pressure, kidney damage, and increased risk of heart attack and stroke. The longer you take them, the higher the risk. Even short-term use is dangerous when combined with other medications. Water pills, ACE inhibitors, mix them with NSAIDs, and you've got a dangerous trio that can seriously harm your kidneys and strain your heart. Here's what makes this so dangerous. You won't feel it happening. You won't feel your kidneys struggling. You won't feel your heart working overtime. Just swelling, tiredness, dizziness, easy to ignore. And because you can buy NSAIDs without a prescription, they don't seem serious. But that's exactly what makes them so risky. What should you do? If you're taking NSAIDs regularly and you're over 60, talk to your doctor today. You might not need to stop completely, but switching from daily to occasional use makes a huge difference. Safer options? Try acetaminophen for certain pains. Use topical creams that don't affect your heart or kidneys. Consider physical therapy, stretching, or heat therapy for chronic pain. The goal isn't suffering in silence. It's managing pain without creating bigger problems. For older adults, NSAIDs seem harmless, but they might be quietly damaging your heart. Number 4. Sleep and anxiety pills, benzodiazepines, the pill that steals your balance. Now let's talk about number 4. These aren't pain pills. They're prescribed for sleep or anxiety. Pills like Ativan, Restoril, Valium. They're called benzodiazepines, and for many seniors, they feel like a lifeline. Finally, you can sleep through the night. Finally, the anxiety eases. Finally, you feel normal again. But what if that same pill is increasing your risk of falls, confusion, and memory loss? Here's how they work. They slow down brain activity. That's why you feel calm and sleepy. But in older adults, they slow things down too much. Reaction time slows. Muscle control weakens. Balance suffers. This dramatically increases fall risk, especially at night when you're groggy. And falls at this age aren't minor. They're a leading cause of injury, hospitalization, and loss of independence. But it goes deeper. Research links benzodiazepines to memory problems, mental fog, and higher risk of dementia with long-term use. That forgetfulness you're experiencing, it might not be aging, it might be the medication. Then there's dependency. Your body adjusts over time. You need more to get the same effect. If you stop suddenly, withdrawal hits, anxiety, insomnia, restlessness, even tremors. It's a cycle. You need the pill to sleep, but the pill is slowly damaging your clarity and stability. What should you do? First, don't panic. Don't stop suddenly. That's dangerous. Talk to your doctor about tapering off slowly and safely. There are better options. Cognitive behavioral therapy for insomnia is one of the most effective treatments for sleep problems with zero side effects. For anxiety, try mindfulness, breathing exercises, light exercise, or certain antidepressants without the same risks. The key? Not every sleep or anxiety problem needs a sedative. For older adults, that small white pill helping you sleep might also be stealing your balance, awareness, and independence. Before we continue, if you're finding this helpful, hit that like button and subscribe so you don't miss our next video. Your heart will thank you. Number 3. Heartburn pills. PPIs, the nutrient thief. Number 3 is taken by millions of seniors for heartburn and acid reflux. Pills like Prilose, Protonix, Nexium. They're called proton pump inhibitors, or PPIs. They work by reducing stomach acid, and for short-term relief, they're amazing. No more burning chest, no more sour taste, no more pain after meals. Just one pill a day, and the discomfort disappears. But here's what most people never hear. These pills weren't meant for long-term use, especially not in older adults. Millions of seniors take PPIs every day for months or years without ever asking, do I still need this? And over time, serious consequences develop. Consequences that directly affect your heart, bones, and overall strength. The biggest problem? PPIs interfere with nutrient absorption. Stomach acid isn't just there to cause heartburn. It helps your body absorb calcium, magnesium, and iron. When acid stays too low for too long, you can't absorb these nutrients properly. Low calcium means weaker bones and higher fracture risk, especially hip fractures that can be life-altering. Magnesium deficiency, common in long-term PPI users, can affect your heart rhythm. It can cause muscle cramps, dizziness, and fatigue. Low iron and vitamin B12 cause anemia, nerve problems, and mental fog, all things that look like aging but might actually be medication-related. There's more. Stomach acid protects you from harmful bacteria. When it's too low for too long, you're more vulnerable to infections like C. diff, a gut infection causing severe diarrhea and dehydration, especially dangerous for older adults. Some studies even link long-term PPI use to higher risks of kidney disease, dementia, and heart problems. The pattern is clear. The longer you take these without reviewing your need, the more the risks outweigh the benefits. What should you do? PPIs aren't bad, they're effective and sometimes necessary during active ulcers, esophagitis, or certain stomach conditions. But they should be temporary, not permanent. If you've been taking a PPI for more than a few months, talk to your doctor. You may still need it, or you may not. Some people can switch to lower doses, take it only when symptoms flare, or taper off entirely under medical supervision, because sometimes relief today shouldn't cost you strength and resilience tomorrow. Number 2, heart and blood pressure medications, when protection becomes risk. Number 2 might surprise you. These are medications designed to protect your heart. Blood pressure pills, heart medications. Wait, how can heart medications damage your heart? Here's the truth. The same medications prescribed to protect your heart can also put it at risk if the dose is too strong, the combination too complex, or your body has changed since the prescription was written. Let's start with diuretics, water pills. They help your body release excess fluid and salt. They're commonly used for high blood pressure or heart failure, but in older adults, they can cause dehydration, low potassium, sodium imbalance, and dizziness. That tired, lightheaded feeling when you stand up, it might not be aging, it might be your water pill pulling too much from your system. Then there are calcium channel blockers, which relax blood vessels to lower pressure. But in some seniors, they cause leg swelling, slow the heart too much, or lead to fatigue and brain fog. Beta blockers are another common heart medication. They slow your heart rate, which is helpful, but sometimes they slow it too much, causing shortness of breath, cold hands and feet, and reduced exercise tolerance. In people with diabetes, beta blockers can even mask signs of low blood sugar, a hidden danger. Here's the reality. Your body changes dramatically with age. Blood vessels stiffen, kidneys slow down. How your body handles salt, water, and pressure shifts. A dose that worked well at 55 may be too much at 75. And it's not just one pill. Many older adults take multiple heart and blood pressure medications. A beta blocker, a diuretic, something for rhythm, something for cholesterol. The combination can quietly overwhelm your system. This is called polypharmacy. One medication leads to another to balance side effects. Before long, you're taking 6 or 7 prescriptions. You feel off, foggy, weak, unsteady. You assume it's age. Often, it's medication overload. When heart medications interfere with balance, kidney function, or energy levels, hospitalization risk goes up, not because of your heart condition, but because of how it's being treated. What should you do? These medications can be life-saving, but they need regular review, not just automatic refills. The goal isn't just controlling numbers on a chart, it's keeping you sharp, steady, mobile, and independent. If you or someone you love is over 60 and taking multiple heart or blood pressure medications, ask, are these doses still right? Are they working together or against each other? Because the right heart medication can save your life, but the wrong combination can quietly steal it piece by piece. Number 1. Polypharmacy. The most dangerous pill is all of them. We've reached number 1, the most dangerous pill of all, not because of what it is, but because of how many you're taking. If there's one thing that poses the greatest risk to older adults, it's not a single pill, it's the combination. Polypharmacy, taking 5 or more medications at once, has become one of the most dangerous and overlooked threats to senior health, and it's shockingly common. Studies show nearly half of all adults over 65 take 5 or more medicines every day. Many take far more. A pill for blood pressure, one for cholesterol, one for sleep, one for pain, an acid reducer, a vitamin, a mood stabilizer. One pill leads to another, and another, until your body's juggling a complex mix of drugs that were never tested together, especially not in aging systems. Here's what most people never hear. Every new medication increases the chance of side effects. Every combination raises the risk of harmful interactions. Every extra pill makes it harder for your kidneys, liver, and heart to keep up. The effects aren't dramatic, they're subtle. You feel more tired, you're less steady, you start forgetting things, your digestion slows, your mood shifts. Most people assume it's just aging, but sometimes it's not, it's the pills. And here's the most troubling part. Many of those prescriptions are no longer needed. They were given months or years ago and never reevaluated. Sometimes the original condition changed. Sometimes one drug's side effect is being treated with another. It creates a quiet spiral, not into better health, but into fatigue, frailty, and dependence. Polypharmacy doesn't just strain your heart, it steals your clarity, energy, and independence. What's the solution? Not stopping everything, reviewing everything. A skilled doctor or pharmacist can help you go through your list, identify outdated medications, reduce what's not necessary, adjust what's still needed. The results can be life-changing. Less dizziness, more energy, better focus, a clearer mind, fewer falls, fewer hospital visits. Sometimes just feeling like yourself again, maybe for the first time in years. Because health isn't always about adding more. Sometimes it's about letting go of what no longer serves you. If you or someone you love is on 5 or more medications, don't wait. Schedule a medication review. Ask the hard questions. Advocate for yourself. Because the most dangerous pill might be the one you didn't realize you were still taking. Conclusion. If you found this video helpful, give it a like and subscribe. We break down health topics like this every single week. In the comments below, tell us, how many medications are you or a loved one currently taking? Have you ever questioned whether they're still necessary? Your story might help someone else more than you know. And remember, sharing this with a friend or family member could be the first step in protecting their heart and their future. This is Dr. Marcus Chen reminding you, take charge of your health, ask questions, and never stop advocating for yourself. Your heart depends on it.